Okay, this is Rich. I'm here with Lora. We're here at Central Florida Foot and Ankle Center at Dr. Jaramillo's office. So, hello, Laura. How you doing today?
Good, thank you.
Great. So, we just want to let some other viewers and patients know basically the experience you've had with us and Dr. J. So, if you could just briefly tell us the reason you came to see Dr. Jaramillo and how long ago it was.
Well, it's been 3 months ago. I had a accident stepping off the back of my pickup truck, severely shattered my foot, and my family doctor sent me to Dr. Jaramillo, and right away I recognized Dr. Jaramillo was very, very attentive, very conscientious. I had a sense with her that I could trust her and trusted her, and beautiful person, took care of my foot. I feel great. My foot is, if you could have seen my foot after I broke it, before the surgery and after the surgery, 3 pins sticking out of my foot to hold it together. The skill that Dr. Jaramillo had and what she had to do to put my foot back together. Just, my trust in her really paid off.
Good. Yeah, glad to hear that. So you actually broken in several places, right? You
Yes.
broke the fourth and the fifth metatarsal, and of course, the viewers can see the boot on you. So you had surgery about 2.5 months ago. So you had a fractured metatarsal fourth and fifth hammertoe correction. So I know you told me earlier your fifth toe, so your smallest toe. What had happened to that one?
It wasn't the smallest; it was the one next.
Oh,
to
okay, it was the fourth one.
next,
Okay.
It was so severely damaged. It was black. It was so black, and Dr. Jaramillo had to use donor bone to rebuild it, and she was very concerned that we wouldn't be able to save that toe. It looked bad, but her skill and my paying attention to what my doctor told me to do,
Right.
it came together, and the foot has healed. I have the toe, and I have a beautifully repaired foot.
Great. Well, good, because I know you said earlier that you're very active, so
Very
I'm sure you're
active.
anxious to get back to all your activities.
Yes, yes.
Just to go over a couple things that you've done in the past then.
I motocross. I ski. I scuba dive. I roller skate. I play pickleball.
So you still all do all that stuff now?
Well, I
Some of
haven't
it?
been roller skating
Okay, yeah.
lately, but still scuba dive. Haven't been snow skiing for some years now.
Right.
But
So you'll be able to at least get back to some of the
yes,
activities?
yes,
Okay,
yes,
great.
yes.
So what was your pain level then? Obviously with a broken foot, it was probably pretty high then.
When I broke this foot, I was, 8, 7, 8.
Right.
It really was painful. Swelling. The swelling was just, I couldn't wear a shoe. And of course, since the surgery, I wasn't able to wear a shoe because I had pins coming out where Dr. Jaramillo had to pin my bones together for them to heal.
Wow.
And her skill pinning them together has brought me back now. I've had the last pin pulled out last week, and now it's more or less trying to start using my foot again.
Right. Okay, good. So you had 3 pins in there, so I'm sure that was very uncomfortable. So what's the pain level now? Now that the last pin's been taken out?
0.
So you have no pain at all right now?
No
Wow,
pain
okay,
at all.
good.
No pain.
So you're just wearing the boot for precautions, and then, but you're not wearing it at the house?
I'm not wearing the boot at the house. This is more or less protected when I leave the house. I'm being very careful. Dr. Jaramillo has given me permission now to start putting weight on the heel and testing out the foot. So we're more or less in therapy now, just slow but sure.
Right, good. We're glad you're feeling better. So would you recommend anybody that maybe, just has some issues, or if they are in major pain, just to see a podiatrist?
I never recognized how important our feet are until you have to stay on a scooter for
Right.
3 months, until you break a foot. Our feet are important.
Right.
It's what holds us up. And if you have issues, we definitely need to see a podiatrist and definitely need to see my podiatrist.
Right, right. Well, good. Well, thank you for your testimony. We're glad that you're feeling better and hope you continue to heal correctly. Thank you very much for your testimony.